are joined now by Dr. Barbara Levy, Vice President for Health Policy at ACOG. Nice to meet you.
Thank you for having me.
Tell us a little bit about what is the MACRA Quality Payment Program?
So the MACRA legislation was the legislation passed in 2015 to supersede the sustainable growth rate for Medicare. So this is a Medicare program that is designed to change the way we deliver healthcare in some ways. It's the shift, in theory, from volume-based payment to value-based payment. It applies to people who deliver care for Medicare patients at a certain volume. So it doesn't affect everybody. And its purpose really was to alter how we look at payment policy.
And what can we expect to change from 2017 to 2018?
So the regulation, which was 2,098 pages that came out in 2016, was pretty onerous for docs. There was a lot that we needed to do to participate in the program. And we were very fortunate to have colleagues and partners in the House of Medicine to go back to CMS and say, this is crazy. And ACOG was really successful in getting this program adapted so that our low volume providers, most of us don't see a lot of Medicare patients. And so now for 2017 and 2018, if we see fewer than 100 Medicare patients or we bill less than $30,000 in bills to Medicare, we don't have to worry about the quality payment program in MACRA. If we're part of a very large system that's a accountable care organization, likely we won't need to worry about these regulations. What we were also able to do is to say, look, we can't flip ourselves on a dime and all of a sudden change everything that we do. So very fortunately for 2017, we have lots of options, including not reporting at all, which we don't recommend. But we can report on just one quality measure and not have to be too concerned. If we report on more than one, we could actually be eligible for a bonus payment. So there are lots of things. We're not sure what will happen for 2018, but we're thinking that a lot of these possibilities of easing into the program will still exist. And of course the rule hasn't come out yet, so we're not quite sure what will happen, but we do think that Secretary Price is sensitive to the burden on doctors' offices about having to change everything at the last minute. And so I think we'll be facing the need to change, but not as quickly as the MACRA legislation initially would have said.
And finally, what are the ACOG resources available on MACRA?
So we have a lot available for our members. There's a website, it's acog.org/MACRA. There's also the CMS website, which is cms.gov/QPP. So of course the government couldn't keep one name. Instead of calling it MACRA, which would have been nice, they've changed the name to the Quality Payment Program, so it's QPP. But our members don't need to worry about that. That link is on our website. So if you just access the ACOG website, you'll be able to find all the resources you need. And then finally, we have staff available to answer questions. Staff who have read all 2,098 pages and are really knowledgeable about how this will impact somebody's specific practice. So with questions, please give us a call and we're happy to answer questions.
So helpful. Nice to meet you. Thank you for your time.
Nice to meet you.